Hi there, I am Dr. Bree, and today I have a much requested video for you, and this is a workout that is a prolapse safe workout for people who want to prevent osteoporosis or for people with osteopenia, which is like the beginnings of osteoporosis. So let's go ahead and begin. We are going to be doing a standing workout. I will show you two moves at the end that are wonderful for bone density and for strengthening your bones and muscles that do involve being on the ground. But I know not everyone likes exercises that are on the ground, and so I'll save those for the end, just in case you don't feel like you want to do them today. So for the rest of the workout, we'll need a chair for balance. And after you've done this routine one time through with me with no weights, if you feel safe and comfortable adding some resistance, like some dumbbells to hold in your hands, or maybe a weighted vest, go for it. But talk to your doctor if you have any questions about this, and definitely stop if you feel any type of discomfort or if anything feels unsafe for your body and for your bones, okay? So we're going to begin with standing heel raises. So feet are spread nice and wide. You feel like there's space in the front of your foot, the ball of your foot, and feel like you're even between the ball of your foot and your heel. Your arch is lifted, and you're going to come up onto your tiptoes, okay? Now what this does is it's warming up the feet and the ankles for some of the balance challenging moves that we're going to be doing, which is really important. You want strong ankles to help prevent falls and to help with good balance and support. This also helps to use your own calf muscles as pumps to pump around the vessels in your legs that help bring the circulation of your blood and your lymph back throughout your body. So heel raises are so wonderful for so many things. Keep going. And I want to let you know that this routine today combines resistance training with your body weight, or if you want to add weights or a weight vest, you can do that. So resistance training, body weight exercises. It also includes balance training and some flexibility. Now, a program that includes resistance training, balance training, and flexibility work can help reduce the risk of fracture associated with falls up to 60%. So do this program regularly. 5 times a week would be wonderful if it feels good in your body. So let's just do maybe 4 more. 3, 2, and 1. You should be feeling that in your calves and your ankles, so let it go. Because this is a prolapse safe workout, we're going to be keeping it pretty low impact, okay? We're going to be using our body weight for resistance and weight bearing exercises, but not a high impact workout. I also want to share with you how to use your pelvic floor. So let's do that right now. I want you to inhale and exhale. Feel your belly gently draw in as you exhale. Again, inhale. And exhale, feeling your belly gently draw in. Now this time when you exhale, I also want you to feel like you can lift your pelvic floor muscles like a Kegel, or if you want to think of it this way, like you're picking up a blueberry with your vagina and your anus. I know it sounds weird, but it's really helpful for you to feel. So inhale, and then exhale. Feel like you're picking up a blueberry with your vagina and your anus. So you're not squeezing it so hard that you're gonna squish the blueberry. We don't wanna squish the blueberry. It's just a gentle lift of those pelvic floor muscles as you exhale. Now inhale and let it go. Exhale, pick up that blueberry gently, hold it, and then inhale, let it go. Now, this time I want you to inhale. Exhale, feel like you're picking up that blueberry with your vagina and your anus and hold it. Hold it even as you keep breathing. So holding that lift as you keep breathing. At the same time, I want you to feel that you're gently toned through your low belly. So you're very lifted through your pelvic floor and your low belly and you're breathing. This is what I call zipping up your core, and it's what I want you to do during the next exercise. So let go of that blueberry, relax, totally let it go, shake it out, and that just gets you a really good foundation for the next exercise. This next exercise is a simple hip extension, strengthening the glutes, these massive muscles which are so important for stability of your hips. So let's go ahead and inhale, exhale all your air out, hinge forward at your hips. Do not round your back. Stick your butt back. Tailbone is lifted. Now, inhale, exhale, feel like you're picking that blueberry up without tucking your tail under. So pick that blueberry up, low belly is toned, and now hold that zipped up core activation as we lift the left leg out behind us. So really feel that glute, squeeze and activate on that lifting leg. Slow and controlled. Keep that zipped up strong core. Keep going. Again, these are huge muscles that we want to stay strong. They help us with standing up. They help us with sitting down. They help us with walking and keeping our balance. 5 more. 4, 3, keep going. 2, and 1. Hold it, and then release down. Stand up and shake it out. All right. Take a big deep breath. Inhale, exhale all your air out, hinging at your hips. We're gonna do the other side, but first engage your core. So inhale, exhale, lift that blueberry. So do your Kegel, gently lifting your pelvic floor, gently toning and activating those low abs, and right leg back behind. Lifting and lowering that back leg. Keep breathing. This standing leg is getting some work too. Be sure that you are not overly arching that low back. You want to keep your core strong and active, really feeling that right glute engage. And I know this exercise might not seem too hard, but it's a great exercise, even though it's still kind of part of our warm-up. It's a wonderful exercise for strengthening those muscles that support your hips and your pelvis. Let's do 3 more. I think that makes us about even. 2, and 1. Okay, stand up. Good. Shake it all out. And next, now that we've kind of woken up our glute muscles, we're gonna do a sit to stand. So you will need a chair for this. Make sure that you are lifting up that pelvic floor, picking up the blueberry, as you turn your chair, if you need to turn a chair. And here we go. Sit down on your chair, and I'm gonna walk you through this. It might seem like I'm walking you through this too slow, but this is an exercise. So what I want you to do is inhale, and you're going to exhale, pick up that blueberry, in other words, lift your pelvic floor, and exhale all your air out as you stand up. Now you're gonna inhale and release. Good. That transition time from sit to stand and stand to sit is when we want to lift the blueberry. So do our pelvic floor activation, the squeeze and lift of the pelvic floor muscles, and exhale our air, okay? So we're gonna do it right now as well as we sit down. So inhale, exhale, pick up the blueberry, and sit down. Now notice also that I'm not rounding or hunching my back as I do this. I am hinging at my hips. I'm keeping my back flat. I'm using my quads and my glutes. I'm using these big, strong leg muscles to help create some tension and some strain on the bone. This builds bone density, these weight-bearing exercises. Plus, they're super functional. So let's again inhale, Exhale, pick up that blueberry and stand. Release. Inhale. Exhale, pick up the blueberry, so lift the pelvic floor. Exhaling all the air out, sitting way back, and release. 2 more times. Inhale. Exhale all your air out. Pick up the blueberry and stand up. And now release. Inhale. Exhale, pick up the blueberry and sit down. Release. 1 more time. Inhale. Exhale, pick up the blueberry and stand using strong glutes, strong thighs. Release. Inhale. Exhale, pick up the blueberry, sit down, and release. Good. Now, we're gonna stand up and do some more standing exercises. So inhale, exhale, pick up the blueberry and stand. No hunching, nice and straight through our spine. With a strong core, with your breath, you're gonna move the chair out of the way. And we're gonna go into some backwards walking. This is so great for balance. So here we go. You are simply going to first make sure there's nothing in your way behind you, no rugs you could trip over, no objects on the ground or pets on the ground, and you are simply gonna walk backwards. Now, if you have a bigger space than I do, you can walk backwards for longer. You could walk backwards all around your room. But for me, I'm just showing you in my tiny little space right here how to do this. All it is challenging your balance by walking backwards. Now, ways you can make this harder are to pretend like you're walking on a tightrope or a balance beam. So it's like your feet are lining up. They're not wide apart. They're actually one behind the other. So that's a lot harder than regular walking backwards. You can also close your eyes. So you can close your eyes and walk backwards. Just be sure that you're being safe, but it's really important to challenge yourself. So keep challenging yourself. Another thing you can do with your eyes open, ultimately, is that as you're walking backwards, you can pause with one leg up in the air. So pause, and then backwards, and then the other leg up in the air, pause, and keep going. So lots of different ways to challenge your balance. Keep going. As you're doing this backward walking with these different challenges, you don't need to worry about strongly gripping or clenching your pelvic floor by any means. I don't want you to worry about that. The main thing I want you to think of is nice, tall, lifted posture, no slumping, and also no like hips forward or hips way back. You want to just be lifted and tall as you're doing this exercise. So you can keep a gentle activation of your pelvic floor and core, but nothing too strong, okay? I don't want you overly gripping your core muscles. So finish up your backwards walking challenge wherever you are. And then when you're ready, you can come back to center. Shake it all out. And for our next challenge, we're gonna do some side motions. This is really important to work all around our hips. Our hips are so susceptible to fracture. Our hips, our spine can really become weak. And so we wanna use our muscles that surround our pelvis and hips in all directions. Let's do salsa, side salsa. So you're gonna go out to the side with your foot. This is my right foot. And then step in the middle and then together. Now out with the other foot. This is my left foot. Then step in the middle and together. So out, middle, in, out, middle, in, out, middle, in, out, middle, in. Keep going. Out, middle, in, out, middle, in. If you are a dancer, then you know this move. Go for it. If you still need it slow, then follow me for one more round. Out, middle, in, out, middle, in. Let's go faster. Out, middle, in, out, middle, in. Keep going. Out, middle, in, out, middle, in. Get those hips involved. Now, this is just a fun way to mix up your workout. It challenges your balance because you're on one foot several times throughout this exercise. One foot. It's also great for your hip joints, for your back, and it's fun. Really get your hips into it. Let your arms be free. Why not dance more? It's so good for your joints. It's so good for your mind, and it feels good. So again, you can go a little bit faster. Out, middle, in, out, middle, in. You can come down a little bit lower, really getting a little bit of a bend through your knee. Keep breathing. Just be sure that you are not rounding or hunching your spine. You want to be tall and lifted through the heart. Tall and lifted through the heart. Let's do about 10 more seconds. Keep breathing. And wrap it up. Good, shake it out. So for our next move, we are going to do an exercise that can be a little intense. If this feels uncomfortable for your prolapse, then please stop and skip it. But I'm going to show you with the chair handy. We are going to do a move that's great for your hips, the strength of the bones in your hips. You are going to stomp with one leg at a time. The pressure as if you were stomping on a soda can to flatten it out. Now, there are a few things that can keep it more prolapse safe, even though it is, and it has some impact for this exercise for sure, but it's going to keep it a little safer if you gently have something for support with your hand. The other thing is to, by a tiny centimeter or less, hinge forward at your hips just a little bit with a flat back. So I'm not talking about hunching or rounding, a little hinge and a tiny bend of your knees. This is not a big bend and it's not a big hinge. It's just a tiny softness at the knees and a tiny hinge at the hips. This hinge puts your pelvis, your bony pelvis, in a position where the bones are going to be more supportive of your pelvic organs. It's a lot more supportive for your bones to be like this than if they were tucked, your butt was tucked under, and there'd be more of an area for descent of your organs. This provides some bony support for your pelvic organs, okay? So, tiny softness at the knees, tiny little hinge at the hips, strong through the core. This is one time when I do want you to zip up. When we walked backwards, I said, you don't need to worry too much about activating your core. This time I do. So inhale, exhale all your air out, and pick up that blueberry nice and strong. Pick up that blueberry, you're lifting your pelvic floor, and hold it as we stomp, 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 stomp. 2 more. 1 more. Good. Now shake it out. Relax. Let go of that blueberry. So relax your pelvic floor. And let's do that 1 more time if it felt safe. If it didn't feel safe to your body, then please don't do it again. But if it felt safe for you, we'll do it 1 more time. So you're going to inhale, exhale, pick up that blueberry so pelvic floor is lifted. You're nice and strong through the core. Softness at the knees, tiny hinge at the hips. Flat back, no hunching and rounding. And we go stomp, stomp. Keep breathing, breathe. Strong core. Good. And shake it all out. Release the pelvic floor. Shake out the bottom, shake out the top. Now, if you have weights and want to add weights for this next exercise, you can. I am not going to show you with weights. This is a great strengthener for your mid-back and for the hip hinge, which is a really important exercise for strengthening your back and your glutes. And it's also just a very functional exercise that shows you how you should move and breathe throughout your day. If you have prolapse, you really need to be careful with how you're moving and managing your pressure throughout your day. So this is going to help. You are going to inhale, exhale all your air out, and hinge at your hips. Okay? Now, you are going to pull your arms up, shoulder blades together, elbows point back. Try not to yank your neck up and don't hunch your neck down. You're looking forward and you're squeezing those shoulder blades together. Core is strong and lifted. You are squeezing, squeezing. Now, arms down, and you are going to exhale and use your glutes and flat back to stand up. Okay, release. 4 more times. So, inhale, exhale, all your air out and hinge forward. Now, strong through that core, you're going to lift your pelvic floor gently, let the blueberry feeling, belly is engaged. You're strong through that core, and you are going to pull the arms up. Shoulder blades are squeezing together. Again, you could do this with weights. Holding it, squeezing the shoulder blades. Knees are slightly bent. Back is flat. Stick your tailbone back. Don't tuck it under. Squeeze those shoulder blades, squeeze the elbows together, core is strong, pelvic floor and blueberries are lifted, and release the arms. Now, don't let go of your strong core, and exhale, squeeze your glutes to stand up with a straight back. So this is using the strong butt muscles to strengthen around the bones. It's using the back muscles. It's using a functional movement to train you. Okay, we're gonna do a couple more times. So inhale, exhale all your air out, and hinge forward. Tailbone is lifted, back is flat, head is neutral, core is strong. So it's like I can feel that gentle activation of my pelvic floor, the blueberry feeling, picking up that blueberry. When you do that, don't tuck your butt under. You want to keep your butt sticking back. Core is strong, low belly is strong. It's a lot to think about. Knees are slightly bent. Pull the arms up, squeeze the shoulder blades together, squeeze the elbows back. Neck is long. So good for your posture, holding it, holding it. One more breath. Core is strong the whole time. And arms down. Now, exhale and squeeze your butt to come up to stand with a flat back. Squeeze your butt flat back up and relax. One more. Shake it out, release. Now inhale, exhale all your air out, folding, hinging at your hips. Tailbone is untucked. Knees are softly bent. And you are going to exhale, squeeze the shoulder blades together. Look forward, knees are bent, back is strong and flat. You are breathing, your core is strong and active the whole time. Now arms down, use your strong glutes to come up with a flat back on your exhale. Good, and release. Shake out those arms and legs. Now, if you wanted to go through that whole thing one more time with a weight vest or add arm weights that you want to use more throughout the whole thing, you can. But I'm going to show you now the exercises on the ground that can be helpful. You can do these also on a bed with a firm mattress, but they're 2 great exercises for strengthening your bones. The first one is a bridge. So feet are underneath your knees. Your middle fingers are reaching toward your heels. You're going to inhale and exhale. come up with your hips. Lift your hips. And let's just do 5 of these. And down. I like to exhale on the way up, squeezing the glutes. And then when I come down, I like to roll down my spine. But you want to be careful with this. If it feels like too much for your bones, then you can do more of a hinge. You don't have to roll down one vertebrae at a time. So you can lift straight up and then straight down if that feels better for you and it's safer for your bones. If you have osteoporosis, then you will have talked to your doctor about doing this or any other workout. And if you ever need a small pillow for under your head, you are welcome to grab a small pillow for under your head. But you don't want to constrict your airway by clenching your, making anything too high where your throat's going to close. Okay, so now we're going to come onto our belly carefully. And we're simply going to do a tiny spinal extension. So feet are behind me, hands are by my chest. If you need a little tiny bit of padding under your chest or your ribs, if you have bone weakness, you might want a little padding for under your ribs. But I'll let you play with that. You are going to straighten one leg behind you and then the other, nice and strong, arms by your sides, and you are going to lift up just an inch or 2. It doesn't have to be much. Use the muscles of your spine to help lift you up. It's not just about your arms, it's about using the back muscles to come up and then down. Let's do 4 more. Up and down. 3 more times, up and down. 2 more times and down. 1 more time and down. Nice. Come onto your side and exhale to press yourself up. Nice job. I hope you enjoyed that workout. You can do it again 5 times a week. At the very least, practice the things such as walking backwards. The glute bridges are wonderful for strengthening these big powerhouse muscles. And if you want more tips on how to live a pelvic floor friendly lifestyle, if you have prolapse, then definitely check out my lift program. It's there for you. I'll put the link in the video description. And until next time, remember to eat clean, move every day, and you will shine brighter, no matter what your age and no matter what your bone density status. Keep moving, keep moving, keep moving. Talk to your doctor if you have any questions. And again, check out my programs and more ways to work with me in the video description. I'll see you next time.